So a common question that we get is, am I a better candidate for breast augmentation or a breast lift? So in general, women pursue breast lifts because they're unhappy with the shape of their breast. But not every woman who is concerned about the shape of the breast or drooping or hanging of the breast, not every woman needs to have a breast lift. A common question that I'll ask patients is, are you happy with the volume of your breast in a push-up bra? If you're happy with the volume of your breast in a push-up bra, then we probably don't want to be considering adding volume with a breast implant. And those patients might be better served with just using a breast lift. Okay, so the goal of a breast lift is to basically change the shape of the breast, to remove extra skin on the breast. If you think about the breast that is sagging or hanging, it's really a balance of two problems. One problem is extra skin. As women get older, with aging, with breastfeeding, the skin on the breast can stretch, and that allows the breast to sag or hang. The other thing that can happen is some women will just lose volume in the breast, particularly after having kids. The breast gets smaller. If you think about the breast like a balloon, if you let air out of that balloon, the balloon will kind of hang. So it's a balance of two problems: loss of volume and extra skin. And we can treat the sagging or hanging breast two ways. Sometimes just adding volume to the breast will fill things out again. Sometimes tightening the skin on the breast with a breast lift will lift it upwards. Sometimes we'll do a little of both, okay? In general, we do measure how much the breast sags or hangs. This blue line is where the band of the bra might sit below the breast. And as the nipple descends below that band, that's when we would steer you more towards breast lifting. So women in here with the nipple below the band or even pointing down towards the floor, those are generally the women that we would steer towards some sort of lifting. Women who have the nipple above that band, those are the women that we generally don't need to lift, and if they would consider a little bit of volume, we can add a little volume, fill things out again with just using a breast implant. And just a quick picture, this is a patient who came in, this is a before, this is after, came in concerned about sagging of the breast. And if you look at her profile, yeah, things are hanging, sagging a little bit, but you can actually see where her band was. It's above, the nipple is above that band. So for this woman, just adding volume, you can see how we filled things out again, okay? And she did not need a breast lift and was a better candidate for breast augmentation. But then another patient at the other end of the spectrum who is hanging and sagging, this woman a better candidate for lifting the breast. In fact, in her, she was not happy with the volume of her breast in a push-up bra, so we added a little bit of volume with the breast implants. This is before and after, and you can see things are hanging, things are pointing down towards the floor. Below the band where the bra sits, adding volume and lifting, we're able to provide a perkier breast, okay? Breast lifting does involve some incisions, typically an incision around the areola and a vertical incision, commonly called a lollipop incision or a vertical breast incision. And those are really the minimum incisions that we can use to lift the breast upwards. So these are really the considerations that we would go through when you're considering breast augmentation versus a breast lift.